We take care of very sick liver patients in this clinic. And so to know with confidence that we have a partner on the pharmacy side that will make sure that the medicines are properly handled and processed and that the patients are going to be communicated to, this whole process just improves the entire delivery of healthcare for our patients.
Once I write their prescription, I don't have to do the follow-up because they do it for me. Jennifer and Timo are stellar and paramount in making sure that the patients get their medications.
We're a nationwide specialty pharmacy. I'm here to help relay information, make sure that everything's running smoothly. I'm in the territory. If you need me to go somewhere, I'm there. While we are the boots on the ground and getting our doctors to use our pharmacy, we also have our partners, which are the provider experience managers.
I support physicians and their staff and their patients. Once we receive the prescription, I can then upload the patient's insurance, see if prior authorization's needed or not needed, what additional information we might need. I make sure that I prioritize in communicating with the providers as well as their patients so that we're all in the same loop of things, and also to let them know what's currently going on with the prescription. We go above and beyond to be able to provide that exceptional service.
I want to make sure that not only are my providers happy with the services, but the patients are happy with our services as well. They need to feel comfortable that somebody's on their side and looking out for them. We are not Acaria Health without our provider experience managers, and that's something that sets us apart.
Every week, Timo comes, we review all of the patients. He gives us updates on what their statuses are, whether there's additional documentation that needs to be met, but he really handles all of the stress and the work of making sure that these patients are getting the medicines that they need. It allows us to continue focusing on the clinical needs of our patients, knowing that the pharmacy needs are being well cared for by Timo and the rest of the team.
Nothing falls through the cracks, and I can focus on patient care.
We understand that physicians, they're juggling multiple patients on a regular basis, and that as long as they send us everything we need, I got it taken care of and they have nothing to worry about.
I'm coming back with patient updates and letting them know where they stand, where their patients are, have they been serviced. Jennifer does the same thing, but she's also the one who's really talking to the patients, making sure that they can afford their medication, making sure that if they can't afford their medication, that we're really getting them to the right resources to bring their copays down.
Patients have told me that speaking to her, it's like a sense of comfort because they know that she's really working with them to get them the medication.
When you work with Timo and Jen, you see this every day, that they may not be in the clinic seeing the patients with us, they still very much personally take an interest in the care of the patients, and it's not just about getting a medicine filled, but it's about getting a patient the medicine that they need.
They're not talking to a 1-800 number or call center somewhere. Our services are tailored to the offices. So we really try to mold our relationship and our communication around the office and the demographic of their patients.
Timo and Jen have really made themselves indispensable to the hepatology community in Brooklyn and New York City at large. If there are any physicians out there who do not yet know about what Acaria can do for your practice, call them.